Good morning and welcome to another episode of Henryford Health System's Family Caregiver Facebook Live. And I'm Veronica Balicki. I'm one of the coordinators with the program. And today we have the honor of being here at P.A.C.E, Southeast Michigan. And with me I have Elizabeth Miles, who's their Community Outreach Coordinator. Welcome.
Thank you.
And Dr. Gwendolyn Grady, who is the Chief Medical Officer of P.A.C.E. And so, thank you so much for agreeing to be on our Facebook Live this morning. We're so happy to be here. And you know, our caregivers are always looking for new and exciting community events for their loved ones. So tell me about P.A.C.E. What is P.A.C.E?
Okay, so P.A.C.E is a program of all-inclusive care for the elderly with the primary goal of keeping them safe in the community and their home. And we do that by bringing them to a place like P.A.C.E here in our center. Our center here, they will receive physical and occupational therapy, transportation brings them in. So a typical day at P.A.C.E would be, they arrive on the bus, we pick them up at their home, they come to the center.
You go to their home and pick them
Yes,
up?
we pick them up at their home, then we bring them to the center. They may start the day by having breakfast here at the center. They'll receive lunch. During the day, they will engage in various activities. They will also be seen possibly by our medical team.
Oh, okay.
So a typical day, again, the therapy and the rehab therapy, a recreational therapy is really good here. So a caregiver could feel comfortable in knowing that when their loved one gets on that bus and come to the center, that they're going to be in good hands at the P.A.C.E Center.
Absolutely. Oh, okay. So like myself, who's a part-time caregiver for my parents, I'm still able to go to work, take care of my children, but if they did need, my parents wanted to stay in their home and not go like to a senior apartment or something like that, change their residence, they could stay in their home and still come and get social activities and get medical care and medications and things like that here.
That is absolutely correct. So when the participant comes to the center, the family member can know and trust that they're in good hands and that they're going to receive all those services and maybe some more. They're going to get socialization while they're here, so they're not isolated while they're at home sitting by themselves. Part of the life enrichment or rec therapy that we have is that they do various activities throughout the center while they're here during the day. So some of the activities could be,
let's take a walk.
It could be bingo. It could be exercising while they're here. They do arts and crafts while they're here. They have singing and music and entertainment. And on some days they actually do hustle lessons. And the seniors also, they decide on sometimes going out for dinner together as a group. But here, I'm going to let you introduce you to Ed, and maybe Ed can answer a few of your questions.
Hi Ed, I'm Veronica. Nice to meet you. So Ed, what do you like about coming to P.A.C.E?
I heard about P.A.C.E, a friend of mine.
Okay.
I started coming, I got a lot of benefits there. Really good people.
So you heard about P.A.C.E through a friend, and you like coming because of the benefits that you get.
I like coming to get out of the house too.
Coming to get out of the house.
Yeah.
Oh, okay.
That's good.
And so, what's your favorite thing that you've done at P.A.C.E? Do you have one, or you just kind of like the whole thing?
Whole thing.
The whole thing. Oh, wonderful. Well, we're going to head to the clinic now, but thank you for answering our question. Have a great day. Have a good day.
So as we stated, part of the center is the clinic, and that's where Dr. Grady is going to discuss the medical team and the services that we provide from a medical standpoint.
Thanks, Liz. So as a part of the program of all-inclusive care, an important component of that, especially for older adults, really does have to do with the medical care. And P.A.C.E provides that. And this is where it happens. So come on in. In the clinic, we're able to provide all of the medical services that are needed. These are our clinical pharmacists, as a matter of fact. We don't provide services.
Thank you. Hello.
We're able to provide all of the medical services that are needed. So for instance, an individual can come in and be seen for routine visits. The CMS, who pays for us to provide these services through Medicare and Medicaid, it allows us to provide routine care, and usually they have to be seen at least twice a year. But the other benefit of having a clinic on site is that people can be seen real time as they need it. So there's also the opportunity to do urgent care. So if a person has an urgent issue, the family member called the night before, mom is not feeling well, we have an ambulance services that are answering service. They can go out and evaluate that individual. If it's determined that they can wait to be seen the next day, then we, using our transportation, we pick them up and we bring them in the next day to be seen. So there is no waiting for a week or 2 weeks to get an appointment with a provider. They can be seen real time. Our providers consist of physicians and nurse practitioners and nurses, and all of the clinical service that they require we can provide here. What else do we do? We provide all of their medications. There are no co-pays. There is no cost to the participant. As a matter of fact, one of the beauties of this program is there's no co-pay and there's no deductible, which is an important thing because, again, as people get older, the number of medications sometimes will increase and the cost can sometimes be cost prohibitive, but we can provide all of those. The other things that we do is we make certain that people are having regular follow-up appointments. If there is an acute issue, we have this bay area that you can see here. So if a person comes in today and they need to have something specific, they need an IV or there's some special care that they need, we're actually able to provide that also real time on site. For the caregiver, the why of this, caregivers are getting older just like, because as a part of the demographics, they're getting older just like the loved ones that they're taking care of. And caregivers need to be convinced that if they're sending their older loved ones someplace, that they're going to be in good hands and they're going to be taken care of.
That's right.
And that's the why that we're here. We're able to help that caregiver keep their loved one in the community longer by being able to provide this wraparound service and help support them to keep their loved one in the community. So the clinic is able to do that through many of the clinical services.
And one of the other things too here at the clinic and the services is that we can do dentistry here. They can see the eye doctor while they're here, podiatry services.
Oh, wow.
Everything is under one umbrella here at our center. So the family members and the caregivers can know that they're going to get the best possible care while they're here in the center, whatever their needs may be.
Wow.
Yeah. And they have a team. Their team consists of a provider, physician or nurse practitioner, an RN case manager, and a social worker. So everybody has a core team that makes certain that all of their needs are met.
Wow. And so how are all of these services paid for?
Yeah. So we're fortunate that we're funded through Medicare and Medicaid. So Medicare and Medicaid give us the money that's needed to provide these services. And then they trust us to take that money and take care of these individuals. So everything that you see, whether it's durable medical equipment, whether it's medications, whether it is the physician visit, whether it's a subspecialty visit, all of those things are covered under the finances that we receive through Medicare and Medicaid.
And there's no deductibles?
No
or anything like
deductible
that?
and no copay. So when they come into the program, everything that you've seen today, from the day center to transportation to rehab to everything you see here in the clinic is covered. There is nothing out of pocket for the participants that come into our program, which is also helpful for caregivers.
Yes, very, because it can get expensive to
Yes.
take care of your loved one,
Yes,
to
it
help
can.
take care of them. So if I want to learn more information about your program, which phone number could someone call or website?
Yeah, so the phone number will be 855-445-4554. That number will get you in touch with someone who can give you the information that you need. It will actually, some of that comes through Liz.
Yes, some of it will come through our intake department, where once you call the 855 number, you'll be directed to our intake coordinator, who will ask you some brief questions, and then we'll start the process to give you information that we need to obtain to get you into the program.
Absolutely.
And we'll also make sure we post that phone number in the comments after we're finished, and we'll also post the website too for P.A.C.E. If you're high tech and you want to go on the web and get information, you can do that as well. So I want to thank both my guests,
Thank you.
Dr. Grady and Liz
Thank you for
Miles.
coming.
Thank you
Thank you for coming and allowing us this
participating,
time.
and we really, really appreciate it. And again, we'll post all that information once we're done here.
Thank you.
Thank you.
Thank you.